Hello everybody, my name is Ernesto Rodriguez and I am the Chief of Emergency Medical Services. I'm very excited to be here today to present our budget to you, our proposed budget for 2014. Your Emergency Medical Services is a highly progressive and very advanced organization. Our mission statement, the purpose of EMS is to change the lives of the people that we serve through a reliable, effective, and affordable clinical practice that exceeds our customers' expectations. We've got some major accomplishments that I want to cover with you this year that we've accomplished. One of them is that we are now accredited through the Commission on Accreditation of Ambulance Services. In addition to that, we are also a Center of Excellence through an accreditation that we received from the National Academies of Emergency Medical Dispatch. That means a great deal to us because we're only one of 3 agencies in Texas that have earned both of those accreditations. We're also an industry leader in providing healthcare resources for patients through our Community Health Paramedic program. We are leading the industry in that innovative area, and we're currently being watched by many providers throughout the nation as we develop that program. We also maintain some of the highest clinical cardiac arrest survival rates in the nation. We participate in a national cardiac arrest registry to benchmark our results. And right now the national benchmark is at about 9%, and we exceed that. We are also expanding our EMS services in the county by converting some half-time ambulances into full-time ambulances and adding 1 new ambulance in the Austin Colony area. We also use evidence-based clinical performance measures for chest pain, stroke, and trauma patients. Some of our key performance data that I'd like to share with you are the things that we look at primarily to see how our organization is doing and what our results are. One area is the percent of patients with cardiac arrest from cardiac causes who are discharged from a hospital alive. Right now the national average is 9%, and in FY12 we exceeded that to 12%, and in FY13 also 12%. We're expecting that that's going to continue to improve as we continue. The percent of patients with cardiac arrest from cardiac causes that are delivered to an appropriate medical facility with a pulse, last year we hit 37%, and we expect to continue that trend as well. We're predicting about 32% in next year's performance, and that's really a factor of the number of cardiac arrest patients that we see every year. As the number increases, that number becomes very sensitive. It is a small population that we're serving in that regard. The total number of EMS responses has grown over the years. Last year, actual was 128,000. We're estimating that it will be 134,000 in the next year to come. Now that number is trending upwards. In FY10, that was 116,000. And as I said, the actual for FY12 was 128,000. So that trend is increasing. Also, the percent of calls that are answered by EMS communications in less than 10 seconds is very important to us. When someone dials 911, they need an answer and they need it quickly. Our goal for performance in that area is 98%. We exceeded that and hit 99.6% in last year's actual, and we're estimating that we're going to continue that into the next year. In FY10, we had 111,000 calls that came into our 911 center. That's significant when you consider that all of those calls are going to be answered in less than 10 seconds. Basically, that's 1 ring. In FY12, that number increased to 122,000 calls in our 911 center. And when you think about it, answering that many thousands of calls in less than 10 seconds and maintaining a standard of 98% is an incredible performance. And that's what our Center of Excellence accreditation is all about in the Communication Center. We also look at the percent of potentially life-threatening calls that we respond to in less than 10 minutes for priority 1 calls in the city of Austin. Our goal is to reach 90% of our patients in less than 10 minutes for priority 1 calls. In 2012, we managed to hit 91.1% in actual performance, and we are predicting that we're going to continue that level of performance in the next year. When we look at the sources and uses of the funds that supply the EMS department, we'll look at 2 areas. One is department revenue, and the other is how we use our funds. In the first area, when we talk about revenue, we see that most of our revenue is coming from EMS services provided. That's what we gain back whenever we do billing services and collections. We're going to have an increase from 19 million to 21.6 million in the next year. The other area that we see revenues increasing is related to our Travis County interlocal agreement. That's the subsidy that the county provides to us to actually fund the services that we provide in the county. The growth from 12.2 million to 14.6 million is a result of adding two half-time ambulances, converting two half-time ambulances into full-time ambulances, and adding one new ambulance in the county community. When you look at the uses of our dollars, most of the dollars that we use are actually related to direct services, and that's the emergency field operations, and those are the paramedics and ambulances responding to emergencies. The other areas where our dollars are spent is emergency communications, that's the 911 center, and professional standards and practices. That's the group that runs our academies when we hire people and provides continuing education to our existing paramedics and performs all of our performance improvement accountability processes. The other area that we spend is in billing services, and that's the group that spends their time and energy gaining reimbursement from Medicare, Medicaid, insurance, and other payers. It's interesting, I'd like to point out that we spend about $1.6 million in that effort, and we gain $21.6 million in revenues from that effort. That's a sign of a job well done. And the other areas where we spend our dollars is support services, and that includes things like the Office of the Medical Director, Human Resources, Supply Management, the Office of Professional Conduct, and our group that does all of our analytics and business research. If we look a little more deeply into the revenue highlights, we see that the EMS services from ground transport is increasing by $2 million. We're going to see some dollars that come in from special events that are becoming more prolific in our community, and we're also seeing an increase in billing and collections. We work very hard to add new technology and new processes and new techniques to seek out better reimbursement from payers like Medicare, Medicaid, and private insurance. We'll also see an increase in standby services. And these are dollars that are used to pay our staff to cover for the many special events that we see in Austin, Austin being a very popular community for events like South by Southwest, ACL, Circuits of America events, and soon the X Games. These dollars are going to be used to pay the overtime for that. We'll be reimbursed by many of the promoters that bring these events to the community. We also see the increase in Travis County services by $2.4 million. Again, that's what I was discussing about the additions of the ambulances. This includes the conversion of two half-time ambulances. One is in Bee Caves, one is in Pflugerville, and the addition of a new 24-hour ambulance in the Austin Colony community. When we continue to look at budget highlights, we're going to look and see what some of the cost drivers are. One of the things that we're looking that we're going to see is a $1.3 million addition into our budget for the annualized cost of the Hunters Bend ambulance. That's the Austin Colony ambulance that I was just mentioning. Another one is the Kelly Lane ambulance. That's located in Pflugerville. That's a county unit. And also the conversion of the Bee Caves ambulance into a full-time ambulance. Our target is to have these ambulances all staffed up and operational by the end of September. The funding for these ambulances is coming out of our local interlocal agreement with Travis County. We're also looking at some reimbursed overtime for standby services at those special events. That is a $0.6 million. We currently receive reimbursement from those events for those special services that we provide. This is to cover the upfront costs of the overtime that's related to that. We also experience some overtime costs that are related to late call holdovers. That's about $0.2 million. What happens there is we have occasions where we're in the middle of responding to an incident at the same time that the end of the shift is approaching. And many times the paramedics have to cross into overtime to complete that call. We don't interrupt the calls that are emergencies for shift change. We have some costs related to increases in the civil service implementation, about $0.2 million. The costs are related to promotional exam development, transcription services, and hearing examiners. We also have some adjustments for medical drugs and supplies, $0.4 million. These costs are shortage driven. There are shortages in medications and supplies that are plaguing the medical community, and it's affecting EMS nationwide. Some examples of these is some of our drugs that we use are in shortage and the costs are increasing. Atropine is a drug that we use for slow heart rates, cardiac arrest, and some poisonings. The cost of that drug is going from $2.78 to $34 a unit. We use 300 units of that drug each year. Glucogen is another drug that we use to treat diabetic emergencies. That cost is increasing from $109 to $120 per vial. We use 300 vials of that each year. Another example is sodium bicarbonate. That's increasing from $2.90 a vial to $6.64 a vial. We use that 1,300 times each year. We use that to treat pH balance and certain overdoses involving tricyclic antidepressants, and also in some respiratory cases. And then there's some drugs that can't even be purchased anymore. Those drugs have to be compounded for us. We have to have those made. That is very expensive. One of the drugs that we use for pain management, fentanyl, is a drug that we have compounded. In CIP, we've got several accomplishments. One is that we have completion of Medic 33, which is our Mueller station. Currently, that station is staffed at half-time, and we're scheduled to be full-time by the end of September. So we're very excited to be opening that new station and staffing it full-time. We also have $0.6 million to expand some of the ambulance bays in stations 2, 8, and 11. Our equipment simply is too big to fit into those stations, and so the expansion should help us park our units, be able to close the door, and keep everything secure. I've got some other topics that I'd like to discuss briefly with you. One of the things that we're very excited about in our EMS is the Community Health Paramedic program. We've already started expanding that program into mental health integration because the need is so great. And like I said before, our entire community is watching how we implement that program, as it is a leading innovation in the EMS industry today. The other thing is that we're now in pursuit of a Texas Quality Award. The awards that we've received from the Commission on Accreditation of Ambulance Services and the renewal of our 911 Center accreditation are just first steps. One of the things that we've already started to do is customer satisfaction surveying. We've initiated a customer callback program like those that are used by hospitals that are already Baldrige Award winners. 100% of our patients that we've talked to at this point are rating us at a 4 or higher on a scale of 5, where 5 is the highest on patient satisfaction. So they really like the services that we're providing. We're also working with our county to improve our county interlocal agreement to make it more in the format of a performance-based contract. And that will set out clear performance expectations, and it'll improve our ability to measure our progress and increase accountability. We've already finished the financial review in that process. We're also looking at re-examination of our system resources. Anytime that we have the opportunity, we conduct best practice visits. We've already started a best practice visit to compare ourselves to other organizations. We looked at how other organizations are managing central supply, and after that, we're going to be visiting with other organizations who are leaders in controlled substance management. So we're excited about improving our system by learning lessons from others. We're also looking at changes in the healthcare reimbursement and regulations. We expect the same progression that was experienced by physicians and hospitals. The first step being pay for reporting, and second being pay for performance. In other words, we will only be reimbursed when we're able to provide certain information to the payers like Medicare. And then once we provide a series of reports, they will set new performance standards. We'll only be paid when we meet those standards. There's also some anti-fraud legislation that's going to affect EMS coming to us in the future. We think that there's going to be increased reporting and increased training requirements that will be imposed on all EMS throughout the state and parts of the nation. Overall, we're very excited about our progress. We're very excited about the year to come. And we hope that you remain confident in the service, and if you see us on an emergency, that you're pleased with our care. Thank you very much.